What if I told you that you can find out whether you have cancer, diabetes, or Parkinson's just by blowing into a device? No blood test needed. No X-ray required. You just breathe out. And artificial intelligence identifies the disease years before symptoms show up. With 95% accuracy, sounds like science fiction? Well, this technology already exists. Hey, I'm Nova, and today I'm going to show you one of the most incredible inventions in modern medicine, a technology that could save millions of lives. And it all starts with a simple breath. Let's understand how this works. When you breathe out, your breath isn't just air. It carries hundreds of microscopic chemical compounds. They're called volatile organic compounds, or VOCs. These compounds act like messengers of what's happening inside your body. When you have a disease, your metabolism shifts. And when metabolism shifts, the chemical compounds in your breath also shift. It's as if each disease had a chemical signature all its own, a specific pattern of molecules that only that disease produces. The problem is, these compounds are invisible to us humans. You can't smell them. They're molecules in concentrations so tiny, parts per billion. For decades, scientists tried to create machines capable of detecting these chemical signatures. But it was really hard. The patterns were far too complex. They varied from person to person until artificial intelligence entered the picture. Researchers developed what they call an electronic nose. It's a device equipped with ultra-sensitive sensors and powered by AI. Here's how it works. You blow into the device. The sensors capture all the molecules from your breath. The artificial intelligence analyzes the chemical pattern in a matter of seconds and compares it with thousands of known patterns of diseases. And here comes the stunning part. This technology can detect diseases like Parkinson's, diabetes, and even cancer with 95% accuracy. 95%. That's more accurate than many traditional tests. But there's more. The electronic nose can spot these diseases years before symptoms emerge. Imagine the impact of that. With cancer, for instance, the earlier you discover it, the higher your chances of survival. Often, when symptoms appear, the disease is already advanced. But if you can detect cancer molecules in breath years ahead, you can start treatment when the disease is still in early stages. That could be the difference between life and death, and it works for various diseases. Parkinson's, for example, is a neurodegenerative disease that's normally only diagnosed when the patient has already lost a large portion of neurons. But researchers discovered that the breath of people with Parkinson's has a unique chemical pattern. The AI can spot that pattern long before tremors or other symptoms show up. This gives the patient a chance to begin treatments that can slow down disease progression. Diabetes too. When blood sugar becomes dysregulated, certain compounds appear in breath. The electronic nose detects this instantly. Now you're probably wondering, how does AI do this? How does it learn to recognize these patterns? The answer lies in training. Researchers collected thousands of breath samples from healthy people and from people with different diseases. They fed the artificial intelligence with this data. The AI analyzed each sample, identified patterns, learned the subtle differences between a healthy person and a sick person. And the more data the AI receives, the more precise it becomes. It's like a doctor who has examined millions of patients. It recognizes patterns that no human could ever see. But here's an incredible curiosity. AI wasn't the first to discover that diseases can be detected by smell. Dogs have been doing this for years. Studies showed that trained dogs can sniff out cancer with impressive precision. They detect the same chemical compounds that the electronic nose searches for. But dogs have limitations. They get tired, get distracted, and you can't have a sniffer dog in every hospital around the world. The electronic nose solves this. It never gets tired. It can process thousands of samples per day, and it's available 24 hours a day, 7 days a week. And the best part, it's fast and non-invasive. No needle required, no surgery needed. You don't even need to fast. You just blow and done. Imagine the impact on healthcare systems. Today, tests like CT scans, MRIs, and biopsies are expensive and time-consuming. Often, they're only done when there's already strong suspicion of disease. But with the electronic nose, you could get a complete checkup in minutes, affordably, accessibly. Hospitals could offer this test as routine. In developing countries where access to advanced testing is limited, this technology could save millions of lives. Mobile clinics could bring the electronic nose to remote communities, villages that never had access to cancer diagnosis could have this cutting-edge technology. And here's an important detail. This technology doesn't replace doctors. It assists doctors. The electronic nose is a screening tool. It identifies who has higher risk of having a disease. Then, the doctor can order more specific tests to confirm the diagnosis. It's like having an ultrasensitive detector that alerts you when something might be wrong. And then the doctor investigates further. Now, you might be thinking, but when will this be available for me? The good news is that the technology already exists. Several labs around the world are testing electronic noses. Some are already in experimental use in hospitals. But to reach the mass market, it still needs to pass regulatory approvals, large-scale testing, and safety validation. But scientists are optimistic. In the next 5 to 10 years, this technology could be in clinics and hospitals worldwide. And it doesn't stop there. Researchers are working on portable versions of the electronic nose. Imagine having a device the size of a phone that you can use at home. Every week, you do a quick test. If the AI detects something suspicious, it alerts you to see a doctor. It's like having a guardian of your health in your pocket. And there are more applications. Electronic noses can also be used to detect infections. COVID-19, for instance, leaves a specific chemical signature in breath. During the pandemic, some airports tested this technology as a rapid screening method. Imagine doing a COVID test in 10 seconds. Just by breathing out, it can also detect if you have a bacterial infection before you feel symptoms. Super useful, right? But like any technology, there are challenges. One is variability. What you eat, what you drink, whether you smoked, all of this can affect the compounds in your breath. The AI needs to be really smart to filter out this noise and focus on the truly important signals, and researchers are working on that. Another issue is privacy. Your breath carries very personal information about your health. How do we ensure that this data is protected, that it won't be used improperly? These are questions that need to be resolved before the technology becomes universal. But the potential is enormous. We're talking about a technology that could revolutionize preventive medicine, that can detect diseases when they're still treatable, that could save millions of lives every year. So what about you? What do you think of this technology? Would you use an electronic nose to monitor your health? Drop in the comments what you think about this. If you liked the video, hit that like button and subscribe to the channel for more fascinating facts about artificial intelligence and health. Share it with that person who cares about their health. I'm Nova, and I'll see you in the next video.